we decided to do our international health project on mental illness in Ethiopia. And this project was created by Cindy Ramirez, Hayden Petka, and Jared Moser. And I'm going to be talking a little bit about the need for a mental illness program in Ethiopia. And mental illness is becoming a major threat in Africa as there are limited resources focused on the physical illness. People with mental illness are being left with little or no treatment, creating a huge concern and problem. The most affected location as of now is Ethiopia, with schizophrenia and depression being the two most prominent mental illnesses. Due to circumstances of the country, such as poverty and religious superstition, mental illness is often looked down on as taboo. And in Ethiopia, mental illness comprised 11% of the total burden of disease, with schizophrenia and depression included in the top 10 most burdensome conditions, outranking HIV and AIDS. These startling statistics show that mental illnesses have been overlooked as a major health priority in Ethiopia, and underscore the need for public health programs targeting mental illnesses. In Ethiopia, there are millions of people that are suffering every day with mental illnesses that are being left untreated. 5% of the population of Ethiopia suffers from depression, and 1% of the population suffers from either schizophrenia or bipolar disorder. And this is a huge percentage of their population. This is millions of people that are being affected by these illnesses. And a big part of the reason that people are not being treated, apart from their culture being how it is that approximately 1.7% of the national health expenditure for Ethiopia was spent on mental health. And just to put that in comparison, in the United States, 7.4% of the national health expenditure was spent on mental health. And so that's a big difference. And they're just not being able to spend very much money, and people are not getting the help that they need. There is no money for the people to get help that they need, and even if they had the means to get there, to get the help, there is only one mental hospital in Ethiopia, and is located in the capital, Addis Ababa. And this puts an extreme limitation on the access that people can have on accessing help with their mental health problems. And along with there being only one hospital, there is 0.02 psychiatrists for every 100,000 people, and this comes out to being one psychiatrist for every 5 million people. And another alarming statistic is that childhood emotional and behavioral disorders was found to be at 16.5% of the child population. This is in large part due to the high number of children that are recruited into the labor force at a young age. So this is a huge number of young people there that are having mental problems as well, and they are not getting the help that they need. And the majority of patients with mental health care problems will never be seen here. This is because most people will see a traditional healer first. If that then doesn't work, a small population may seek help from Western-style service, if accessible. Others who can't afford medicines, don't believe they work, or just do not know they exist may be chained up by a family who can't cope and have no other options. Fewer than 1 in 10 most severely affected people ever receive the treatment they need there in Ethiopia. And as you can see from the data, there is a huge need to get people the knowledge they need and access available so that these mental illnesses can be treated. And as far as funds for the project, we looked at getting some grants from the Bureau of Population for Refugees and Migration. This is from the United States. And we can access $1.5 million a year for our program. There's also other programs such as the Ambassador Special Self-Help Program and the PEPFAR Small Grants Program and the Julia Taft Fund for Refugees. And through these programs, we can access another $1 million a year. And so this should provide substantial funding for our program.
Program objectives. Number one, our number one objective is to strengthen effective leaderships for mental health. So in the coming slides, we'll touch a little bit more in depth about what we mean, but just an overview. what we mean with strengthening is we really want to educate and empower these physicians that are out on the field with the tools they need to help evaluate and help cure some of the mental illnesses that are out there. So that's just giving them the tools to maintain a good mental health with those people that they come in contact with. Objective number 2 is to provide comprehensive, integrated, and responsive mental health and social care services in community-based settings. So again, this is we want to be able to help these communities that are suffering from mental illnesses and giving them the medical services that they need, and using different methods to do so, to be able to not cure, but be able to give them help in these areas of mental illness that they have. Objective number 3 is to implement strategies for promotion and prevention of mental health. So mental health and mental illness are two different things. Mental health is it's the emotional and psychological well-being of a person, and we want to kind of help promote good mental health. So that could mean learning how to cope with stress, helping people really have good self-esteem about them, and just different strategies that we want to be able to promote and help them be able to understand. And something that I want to address is we cannot prevent mental illnesses because it's a combination of many factors. However, mental health we can prevent, and we can prevent from deteriorating or causing them to be able to fall into a mental illness. And that's what we really want to work on with the community that we go out in Ethiopia and see. Objective number 4 is to strengthen information systems and research for mental illnesses. So since we are out on the field, we want to gather as much research and really study the community, the environment, anything that we really can to give us information and help us make the intervention program just to strengthen it and make it better to service the community. We feel that the most effective way for intervention with mental illness is to build an alliance with the organizations that already exist in Ethiopia. So there's many organizations or charities that are already established in Ethiopia that these people really, that the community has built a relationship with and built trust. And we want to come in and become part of their, kind of just jump in and be part of their organization as well. We want to use them and build an alliance with them to help strengthen, again, the mental illness or mental health part of their services that they lack in. So our intervention would include the recruitment and training of training of current medical staff members in their local clinics around the villages or communities. Our vision really is to have a one-stop shop for all, instead of kind of sending them from this specialist to this specialist to that specialist, because what we've researched is that we find that when we do that, again, the likelihood that they have the methods of transportation is very unlikely, and also having to take off for work or again travel for far from home to go from one doctor to another is just it's just unreasonable, and it really doesn't happen. So we just want to be able to kind of train the medical staff that these people from Ethiopia see on for their checkups, and be able to train them, and from there be able to build a trust so that these services can be given to them at one place only. Mental health training. So this is a big part of our intervention is specializing ourselves in being able to train professionals and recruit people who could really help Ethiopians with mental health and their mental illnesses. And just our strategy that we want to do is we want to be able to train overseas professionals. So whoever the medical professionals are that are in Ethiopia, we really want to be able to give them the tools to to treat mental health and mental illnesses. And one of the ways is conducting assessments. So we want to be able to help these medical professionals, whether it's a physician, a nurse, or to be able to ask certain questions from their patients and be able to kind of assess how they are mentally healthy mental-wise. And another thing that we want to do is we want to be able to train them in kind of learning and understanding the different types of mental illnesses that are out there. When I say mental illnesses, this doesn't just mean depression or being bipolar or schizophrenia, although depression and schizophrenia are the top mental illnesses in Ethiopia. There's others. We could also call autism a mental illness. So we just want them to learn the different types of mental illnesses and really familiarize themselves with it, so that when they come across certain red flags or certain things that the patient is telling them, they can be able to recognize these. And so this is one of the biggest ones that we really want to help train these professionals to know. The other one, another one is train them in asking specific questions. Again, this is part of the assessment. Train them in treatment methods. So not only do we want them to know specifically what types of mental illnesses there are, we also want them to know what kind of treatments they can give, or what they can do to be able to help alleviate their mental illnesses. We also want to train by using videos. Just kind of, again, we have one here that on this slide that is we have a video of mental illness, and kind of just explaining what it is and how it happens. And not necessarily, it's not a video necessarily about like international mental illness, but it just kind of gives an overview of how it affects people.
What is mental illness? Hi, I'm Amalia.
And I'm Matthew.
If you have a parent with a mental illness, then you might be wondering, what's going on? Where did this come from? How did they get it?
A mental illness affects people in the brain, and it changes the way they think and feel and behave.
When someone has a mental illness, they might have intense emotions, like sadness or worry, or they might have thoughts that get in the way of their usual daily life.
And then the other thing they want to do is we want to be able to bring overseas well-prepared professionals in their field. So this could be psychologists, sociologists, psychiatrists, psychologists, and other doctors. Social workers actually are other professionals that could help in this area. Counselors. The other ones would be medical students. I lost the word. Medical students that can help in coming overseas and kind of practicing as well, giving their service here. Something that we would have them do is 15-hour in-service training. So there's an organization that provides this in-service training, and it really helps. It helps prepare some of the professionals, and it's the acronym is NAMI, NAMI, and this is the organization that we would actually use to conduct the 15-hour in-service training. And again, the people who are being recruited in the States, we want them to also be very aware of the different types of mental illnesses, as well as the treatment that would be required to treat these illnesses.
This is Hayden Petka speaking now, and in regards to the mental illnesses that are most prominent in Ethiopia is schizophrenia and depression. We focus on these two, and there's a lot of barriers associated with treating these mental illnesses. Not exactly the easiest thing to do. So there's some barriers that need to be overcome in order to treat these mental illnesses that these people have in Ethiopia. Basically, part of the circumstances as to why it's so hard to treat these two mental illnesses is due to the fact that this is a country that is in deep poverty, and they have a lot of religious superstition as well. Mental illness, when someone has it in Ethiopia, there's a lot due. It's mostly treated as a taboo. So in that aspect, it's kind of hard to treat. And also, there's not a lot of mental health professionals in the area of Ethiopia. It's not exactly a paradise that a lot of doctors are flocking to. In the country, in terms of training, there's only about 2 or 3% of doctors in the area that are even trained or devoted to mental health. Let me just go into a little bit more detail about that as well. So I found out that there are only 0.02 psychiatrists, 0.3 psychiatric nurses, and 0.4% staff per 100,000 population of the nation of Ethiopia. There are very few mental health professionals that graduated in recent years. For example, only 2.7 nurses and 0.003 psychiatrists recently graduated in the past couple of years for every 100,000 people in Ethiopia. So we know that there aren't a lot of health facilities for these people to get treated for mental illnesses. To go another barrier that I have mentioned in the slide, I mentioned that there's a lot of poverty as well. There's not a lot of food access that they can get, not a lot of water. I even have a picture at the bottom right of the slide. You can see a bunch of kids having to fetch their own water and bring it back to their town. Picture on the bottom left, you can see this the poverty right there. That picture shows it all. I found a very depressing statistic as well that doesn't help the cause for mental illnesses. The statistic itself is very depressing, and found out that as of just a few years ago, the life expectancy at birth of a baby that is born in Ethiopia is 46.8 years old for a male and 49.4 years for a female. So due to the poverty, they're being malnourished. The mothers are being malnourished, don't have access to health care. They are only living into their late 40s. Basically, it's not a long time at all. And I also found an interesting statistic showing that only about 49% of the population that are men are able to read, and 33.8% of the women are able to read. It doesn't really have to do with mental health, but it's an interesting statistic to show how in need this country is of outside help, whether it be schooling and food and health facilities. They need it all, essentially. So these statistics don't help mental health at all. But what can help is overcoming these barriers, helping them get out of poverty, give them food, and have highly qualified physicians, training programs, public health programs to help treat these people in Ethiopia.